to our first keynote speaker who needs no introduction himself. Please welcome Raymond Loretan, Executive Chairman of the Swiss Medical Network. So, Raymond, the floor is yours.
Good evening, everyone. My voice is not as usual. I'm not sure it's flu, cold, or COVID, but normally I am a tenor. Tonight you're going to have to bear with me with a baritone voice. Sorry. Future of health, ladies and gentlemen, must be integrated, collaborative, and sustainable. I will make 3 points tonight. First, the diagnosis, where we stand today. Secondly, the solution proposed by policymakers and stakeholders. And thirdly, and finally, present our vision, which we are already implementing in some region of Switzerland. Diagnosis, let us begin with this. And to summarize, our system, health system, is very strong in many ways, but at times it resembles as an orchestra without a conductor. Each musician plays with talent, but without coordination, harmony is lost. And what are the reasons? Let me mention 3 main reasons. Too often, and it was already mentioned, this system still functions in silos. Stakeholders try to optimize their own interest, sometimes at the expenses of the whole, and mostly not voluntarily. It's a matter of culture. And if everyone seeks only to maximize its profits, the health system cannot work. And what we need is really to break these silos, and we could add few more silos to this one, like insurance, for example, pharmaceutical, doctors, private and public sector, cantons, confederation. What we need in the system is coordination and alignment, and what we call in our language is integration. Another weakness is the very low level of outpatient care. In Switzerland, only 20% of services are outpatient. In Denmark, you look at this picture, Sweden and the Netherlands, this figure is nearly 60%. And this gap shows a huge potential for improvement if the right incentives are put in place. And the third reason is our tariff system. If you look at this picture, this creates a lot of challenges. In the ambulatory field, under TARMED today, and next year TARDOC, and nobody knows exactly what it means and how it will be implemented, each procedure is billed separately. And this is a rewarding activity, but also encouraging volume and cherry picking. The more you consult, the more you cash in. And in the stationary, Swiss DRGs and future outpatient flat rates, which will be introduced next year also, aim to control cost and length of stay. That's in a good direction, but they do not necessarily foster better overall performance. So the conclusion is, in summary, our system provides quality care and generates wealth. that is very good for GDP and wages, but this system is too costly and is becoming increasingly difficult for insured person to bear. So what are the possible solutions? I'm going to mention 5 points, but one, a prerequisite. In the perception, healthcare costs are often seen as price time volume. But we must add a third factor, which is quality. And without quality, this formula makes absolutely nonsense, as we will see later. But the first solution is the identical financing. That's one key lever, is identical financing for inpatient and outpatient. Today, outpatient care is financed 100% by insurance, while hospital care is split between insurance and canton, 45-55. This penalizes outpatient care. From next 2028, EFAS, which is a strange name for Einheitliche Finanzierung ambulatorisch stationär, it's German, will harmonize financing and about 70% insurers and 30% the cantons. And this model, this transfer of model, ensures fairness and solidarity. That's one way, and it's on the best way, but with a lot of unknown factors. The second way is to remove the negative incentives, as you can see on this slide. Uniform financing is definitely not enough. We must also adjust outpatient tariffs so hospital can cover cost. At the moment, these tariffs do not cover the cost. Adapt hospital operating models for efficiency in outpatient care. And finally, ensure outpatient services are sustainable in the long term. Here is the summary. The next way to cure the system is to limit the volume. That's a very sensitive topic. And there are 3 ways to limit the volumes. The first one is a top-down approach, top-down global budget, but there is a real risk of rationing and long waiting list. We don't want this one. The second one is negotiated maximum volumes between insurers and providers. But for those who are involved in this kind of negotiation, they know that very often it's a deadlock. And the third one, the third way, which is quite a challenge, but which is very innovative, is the capitation model, which providers receive a fixed amount per patient. And this model creates entrepreneurial responsibility and incentives for the prevention. I will come back on this model because that's the one our group decided to follow. Another way is measuring qualities. Fourth measure. If you talk to doctors, very often they tell you, we cannot measure quality. In fact, you can. Patient can compare restaurant online, but not doctor or hospital, which is not normal. And competition must be based not on quantity, as it is now, but on quality. So there are ways to measure quality. with data based on the result of medical services, the so-called PROMs and PREMs. The people involved in this field know what it means. Patient-reported outcome measures and patient-reported experience measures. These measures can be used to measure quality. One element which is very central to measure this quality is the quality of health records, electronic health record. And you know the drama of the health record in Switzerland. We are very far from a solution. This has to do with politics and federalism, which sometimes brings some advantages and sometimes not. And every canton has its own system, and every hospital group has its own system. And this is absolutely not acceptable. And in this field, urgent action must be taken. We know with DG Santé and so on, there are a lot of things underway, but when you look at the schedule, you think that the solution will be 2040 or 35, at 40 I exaggerate a little bit, but we need solution now or tomorrow. And the fifth way, is coordinating care. And this coordinated care allows you to break down silos and bring together, definitely, hospital, doctors, pharmacy, long-term care, insurance, in a single coordinated network. And that's actually the solution we are proposing. And it's the vision that Swiss Medical Network is trying now to implement. This integrated care solution tries to transform a system that benefits some into a system that benefits everyone. We want to keep citizens healthy. Here you have the magic word of prevention. We want to improve patient services and to align, and this is central because you hear a lot about integrated system, but this one is unique, is to align insurers and provider. So this system, as you can see, will move us from a sick care system, fee-for-service, traditional model, volume, to a healthcare model, full capitation, with fixed and predetermined payment per member population. I'm not going to go into details because we don't have the time, but this slide shows quite well the difference between these two systems. And it allows to align interest doctors who today often have different interests, hospital, doctor, pharmacy, insurer, rehabilitation center, long-term care providers. And the system integrated accompanies patients across their entire life journey, prevention, acute care, rehabilitation, home care, and healthy aging. So we did not invent this system, but we had its sources of inspiration. As everyone knows, it's the Kaiser permanent model in the States, but also the Ribera Salud in Spain. But we had to adjust the system to the Swiss dimension, to the Swiss characteristic, to the Swiss system. So we created a product, an insurance product called Viva. And Viva represents preserving health as long as possible with high quality at reasonable cost. And what are the levers for change of this insurance? We achieve this with healthcare managers. This is new. These are real coach for patients with a unique electronic health record, chronic disease programs, hospital at home, and prevention and screening. Here I'm going to list the different possibilities without getting into details because I see Olivier is nervous about me keeping the time. But we can manage the chronic condition, hospital at home. which works, and we already saved a lot of money in Réseau de l'Arc, thanks this hospital at all. We have this healthcare manager, which, as I said, these are experienced nurses which are coordinating with doctor and are available by hotline and teleconsultation. We have a quality indicator. We measure it with 33 key indicators covering processes, outcome, patient experience. This is a very complicated slide, but it explains a little bit the kind of capitation we want to introduce. We're not there yet, but for example, the cantonal contribution are evolving towards flat rate payment per member, similar to capitation, aligning incentives across the system. And this model is integrated in our sustainability strategy. We have a sustainability strategy with 3 pillars. First is pioneering integrated care. That's what I just very briefly explained. But we are also the empowering people, and you see also the innovation hub in there, and developing sustainable financing for healthcare. These are the 3 pillars of our group. We think that we are uniquely positioned. It doesn't work anymore. He thinks the time is off. We are uniquely positioned to implement such a model. It's a group in all 4 language regions, in 15 cantons, with over 21 hospitals, around 2,500 doctors, and so on and so forth. So we think that we can expand this network, and that's our strategy. We started with Réseau de l'Arc in the Jura Bernois region. We implemented this year, this is our dispositif. Réseau de l'Arc, last year we started with Ticino, what's her name? The ANA network, Rete Santana, and next year in the region of Zofingen, we just bought this public hospital together with the public hospital, Kantonsspital Aarau. We're going to introduce a 3rd region, and we're already exploring further region. What is very interesting in the course of this implementation, insurance and public hospital took part also in our capital. So in my board, I have insurers and I have public hospitals, which is unique in Switzerland. So we believe that this is one of the solutions to take the health system out of a kind of crisis, but dead end, and we will develop this very voluntarily. Thank you for your attention, and I wish you a very good meeting.
Thank you. Thank you so much, Raymond. It's always a pleasure to hear and learn from you.